Welcome to Skyscape's free webinar series. Today's topic is remote nursing skills and care plans, note-taking. I am Kristen Snowdon-Smith from Skyscape, and I will be the moderator today. This webinar is being recorded and will be available on demand with a copy of the presentation, and we will notify you when it is available via email. Our speaker today is Dr. Tim Bristol. Tim is a faculty and student success specialist. He works with a number of colleges and universities and resides in Minneapolis, Minnesota. Tim has been utilizing technology in the classroom, clinical, and lab setting for over 20 years. His motto is, "Today we will learn how to learn." I'll now hand the floor over to Dr. Tim Bristol.
Thank you, Kristen, and thank you everyone for joining us today. I'm really excited to share with you a few ideas, tips, tools, and tricks related to all of these situations where we're running into. We have to take things remotely. We have to take our learning, our lesson plans, our skills, our experiences online. How do we manage that? How do we look at that? And I've been working with literally tens of thousands of faculty and students over the past 2 months, helping them navigate how to do this. And one common theme is how do we navigate it? How do we keep it straight? How do we make sure that learning is still happening at an acceptable level? Because you and I both know now is not the time for us to lower the bar. Now is the time for us to actually help the students attain even more. And so what I'm about to share with you are a series of tools that are going to help you make sure that your students are really diving into that higher order thinking, that clinical judgment that is so vital right now. So I want to start by sharing with you a tool called Skills Hub. And this hits on so many of the needs that we have right now in nursing education. When it comes to how do we help the students still practice their skills, still stay up to speed on their skills, still see the connection between a psychomotor skill and the deep clinical judgment that is vital for success in clinical settings. The Skills Hub helps us pull all these pieces together. And it does it in a way that allows the student to make sure that they are on track. Not just did I memorize the 32 steps of trait care, but did I integrate clinical judgment along the way? And how can we as educators be certain that this is actually happening and track this? And so Skills Hub is a very unique tool that allows you to pull all of that together in a way that makes sense, in a way that is simple to use, and in a way that gives you some great data on the other side. All right, so we have a polling question here for you. When do you teach skills in your curriculum normally? I know that in a lot of our environments, we're challenged in a few different areas. So go ahead and click in here. I think Kristen has the poll open for us.
Yep, the poll's open. Go ahead and vote. We'll leave it open for about 30 seconds more.
There we go. All right, the clicks are coming. The clicks are coming. There's two things that I want you to understand. First of all, we know that half, and this is before coronavirus, half of all people that pass NCLEX, also known as half of the people that are graduating from your program, half of them are committing a medical error shortly after passing NCLEX. That's current research, okay? Kind of terrifying if you ask me. The reason I bring this up is a majority of those medical errors are related back to fundamentals, and fundamentals is where a lot of these skills initially are explored. So what we've got to do to start addressing this epidemic, and we have a pandemic of coronavirus, we also have a pandemic that has continued for many years of the medical errors. We have to make sure that skills and fundamentals happen across the curriculum. And the Skills Hub is going to allow us to do that in a consistent, logical fashion, not just when we're remote, but when we're in person as well. So I think we've got our clicking done here, and the results are here somewhere. Let's see here. Oh, there we go. There's our results. Yes. So it looks like about half of us have it across the curriculum. About a quarter of us are in the first term, and about a quarter of us are in the first half of it. So with Skills Hub, we really, thank you, Kristen, that was perfect. So the Skills Hub really allows us to start to pull fundamentals across the curriculum. Now, Skills Hub has some distinct areas such as learning and practicing and logging, but when we start talking about the learn part of it, some things that I really want you to understand is this goes way beyond a list of skills. This goes way beyond the steps in the skills. What the skills log does in Skills Hub is start to give students that current evidence base, okay? Everybody say current with me. I'm gonna listen. I think I heard all of you say current. Good job. Our current evidence base is super important. And the way Skills Hub is set up, the way the skills log, the learning part of it is set up, they're constantly going to be pointing towards updated evidence base. And so you and I both know that when a book is published, it almost instantly is out of date. There's something in it that is now out of date. Well, here with the Skills Hub, they're actually going to the current evidence base. What's currently happening in practice? The CDC, the World Health Organization, all these other organizations that have currency related to some of these assessment areas, these needs. So they're being trained while they're learning about a skill through the Skills Hub, through the skills log. While they're learning, they're being trained on how to look for the evidence base, how to make sure this is current. Okay, they're going to get videos. They're going to be pointed towards videos of many different people in practice and education that are performing the skills in different ways. They're going to see a myriad of different practices that's going to help them start to apply clinical judgment. Okay, what are the key principles of this skill? Not just can I memorize the list. So this learning allows skills, which I've been teaching skills for many, many years. And if you're not careful, your skills can be a very low-level learning activity. What we do here with these 120 skills checklists, there's 12 different sections. The students are continuously going to be challenged to go a step deeper. So that's very important to understand about the Skills Hub. And you're actually looking at screens here from a student's phone. Okay, so this would actually be on the student's phone. As far as this part of the software. Now, what can they do with this practice? Well, there's many different things that are available to them. For instance, they can be in lab and recording how many times. I don't know, can you guys see my cursor? Is that showing up there? You can be in lab. Okay, it is. Okay, good. And how many times have you practiced it? You can upload a video of you actually performing the skill, which is fantastic for the remote because that video is going to pop right into the instructor's area. You can have a peer review you. You can review yourself as a student. That self-evaluation. So create your video, then give yourself feedback, evaluate yourself. That's a key skill. These tools are going to track where the student is if they turn on location tracking, and you'll actually see that in the instructor dashboard. They're going to be able to document if they've done the skill in practice. Very powerful tool, very powerful tool. When they're creating these videos, and this is just a simple video that they can create on their handheld device, their iPhone, their phone, whatever they're using, and upload it, it becomes a part of their log. I'm going to show you here, they're going to actually be creating their own portfolio of not only skills performance, but also also clinical performance across the curriculum. So this is a very important thing for us to consider right now with remote testing, with remote clinicals, with remote everything. This allows the student to do that. That peer review area is just fantastic, and they can do their self-review in there. They can actually get feedback, and you'll see that. All that they have to do with their device for the video upload, for instance, is actually go in and grab the images. I'm sorry, was there a question? Nope. Grab the video and upload it there. So it really works smoothly. And you know, regardless of their abilities with their phone, they're able to walk through these steps very smoothly. And like I said, when this video gets uploaded, it's going to show up in the instructor dashboard. And so this is just a really fantastic solution in my book. I've thousands of faculty and students over the past 2 months I've been working with. This has been one of their big pain points. How do we keep the students focused on their skills even when they are remote? Now it goes on and takes it to the next level. As related to this skill, okay, you've learned about it, you've practiced it. Now let's take some quizzing. Let's get some quizzing in the mix, and they're going to be able to track their own quizzing. How are they doing with understanding the foundations behind these skills? Where are your gaps? Where are your strengths? Where are your weaknesses? And this comes into play for all 120 skills. And you as the instructor are going to see their performance and their practice here as well. So this is very important to them. We know how much students love quizzing and a quick quiz and an NCLEX style quiz and all those things. This helps them start to see that this skill is just a lot more than a list of steps. And so these are, you know, you're going to have this for all 120 of them, really going to help them and get them start to see those connections across the curriculum. So if you have any questions, please be chatting them in. Kristen is watching for us, and she knows how to interrupt me and hey Tim, over here. So but when it comes to managing skills remotely, the Skills Hub is definitely a powerful tool, a really powerful tool. It puts everything in the hand of the students. You see it instantly in the faculty dashboard, and the students are going to be able to see it on their dashboard as well, creating their portfolio of their skills development across the curriculum. I love the way that this packages it, especially when you're using it across the curriculum, because now students can look back over time and go, oh my goodness, that was the first time I inserted a Foley catheter. Oh my goodness, that was the my practice video when I initially was learning cardiac assessment. And they can actually go back and see these things over time. Very powerful way to learn and keep it all in one place. The next part of Skills Hub that I want to share with you is tracks patient encounters. And when we're talking about remote learning or remote clinical, these patient encounters can, yes, be in person, obviously, and it will track that very well, but it also can track their patient encounters. For instance, if you're using a vClinical and virtually they're going to clinical, they need to track their patient encounters there as well. I get it almost daily now. How do I grade my virtual clinical? Well, the best answer to that question is the same way you would grade an actual clinical. And so, for instance, if you're doing virtual clinicals and you normally have this paperwork that needs to be filled out as part of the virtual clinical, well, step number one is demonstrate a proper head-to-toe assessment or a focused assessment if you want to go NCLEX style. And how would they document that here? Well, they can document it here in the clinical log. They can document it on that piece of paper, and they could do that actual assessment in the Skills Hub, in that skill log. They can upload a video of them doing that skill, whether they have to simulate it on a pillow or one of their children, like my poor kids when I was going through nursing school, right? Well, they can simulate it, record it into the Skills Hub. They can track it here on the clinical log. And they can, if you've got your paperwork, you can actually modify the clinical log here to match your paperwork better. Keep clinical moving. When we're remote, even though they're doing simulations, even though they're doing those virtual clinicals, keep the clinicals moving, keep assessing them. These fields here that are going to show up on the student's phone, you can actually configure those fields. And you're going to see all this data is going to pop right into your faculty dashboard. And it's going to allow you to view their logs. You can approve them. You can give them lots of feedback. Great dialogue here, but this really does level the playing field. The students become very comfortable with this very quickly. The faculty can adjust it, as I said, across the curriculum and or for different settings. It's just a very powerful way for you to continue to track these clinical experiences. It all becomes a part of it. Now, I want to talk to you for a few moments about the dashboard. The dashboard has a couple of different roles. First of all is the administrative role. And so, for instance, let's say that you have certain skills that are taught in semester 1 or certain skills that are supposed to go with clinical 1. And then you have certain skills that go with clinical 2 and another set of skills that go in that final semester, okay? Well, you can actually go in with the administrative tool and assign where skills should be showing up across the curriculum, which cohorts of students should be associated with that skill or that clinical experience or that module of skills, and then which faculty are associated with which cohorts. Very powerful tracking tool. Administratively, if you're a director of nursing or a lead or a curriculum coordinator, the data that you're going to get out of this tool by organizing it this way is so powerful. When you talk about your systematic plan of evaluation, when you're getting ready for the Board of Nursing to come visit, hey, many of us are going to have to start explaining over the next 6 months to our accreditation bodies and boards of nursing, what were your students doing when they couldn't go to clinical? What were your students doing when they couldn't go to lab? Here, you're going to have it all in one location. And you're going to be able to easily organize, access, report on this data in a cumulative format, in a summative format that allows you to give that information to those bodies and or to put it into your systematic plan of evaluation if you're doing it that way. So very powerful way of managing that and in the admin role. Now the faculty role is super fun in the sense that you get to watch all these different things the students are doing. So you're going to be able to see the students actually progress over time. You're going to be able to see those videos that were uploaded for the students and give feedback. You're going to see, are the students doing the different activities in both lab and clinical? How are they doing? How are they doing with their actual quizzes? Sorry, I lost my words there for a moment. And all of this is going to be logged and kept in one location. Okay, so over time, you're going to see this student's progress and how are things going with them. And you've got so much great information here. Like I said, everything from location to the video. Did they get feedback from a peer or did they do self-evaluation? This report is fully downloadable. You'll be able to manage these reports in many, many different ways. The interface is super friendly and just makes sense. Just makes sense. If faculty, if they don't have time to do a full in-depth review of each individual student, they can just simply use a drop-down menu. They can simply use a drop-down menu and type in 1 or 2 words, or they can follow whatever the guide is for normally grading clinical and add information, add comments that way as well. So this really does allow the students, the faculty to engage what students are doing on a very efficient, a very effective basis. This is many times we shield our adjunct clinical instructors or our part-time instructors from complex tools. This is not a complex tool. This is very quick and intuitive and will definitely save the faculty time compared to trying to manage a bunch of Zoom videos, and then, okay, they're emailing me these PDFs over here, and now they're calling me, and now they've got this uploaded in the discussion forum, and I'm going to all these different places. Whereas here, it's all in one place. It's all very accessible to the faculty. The data that they get here really does help, especially when we're dealing with remote and or you're a clinical coordinator over 8 different clinical groups, and your students are all over the metro, are all over the countryside, are in 4 different cities. We work with one big school in Southwest Minnesota that manages students literally can be 3 hours in either direction from the campus. Very powerful to have this kind of quick location tracking. Where are you? What's going on? Does this fit what I thought you were going to be doing? Just as for faculty, the students have access to this dashboard as well. And this is very important over time. Over time, it allows them to start building these habits of watching themselves. How am I progressing over time? Even though, remember, my philosophy is skills should be happening every semester. Well, what student leaves skills and fundamentals and takes all their paperwork with them and revisits it every week across the curriculum? They don't do that. Whereas here in Skills Hub, they're going to own it across the curriculum. They're constantly going to be in here. They're going to be seeing, oh yeah, there's that skill from semester 1. There's that skill from semester 3. They're going to keep going back and forth. They're going to see it. It's going to be right there in front of them. They're going to be tracking their progress, and they're going to be creating a portfolio that's super powerful, that literally is a concrete assessment, a concrete log to include video, to include quizzes, all these different parts and pieces. It's a concrete collection of what they've actually been doing. Not, oh, I had a good clinical experience here, as opposed to, here's my portfolio. Here's my log of everything I've been doing. When you talk about that capstone course, that leadership course, and they need to come and build a portfolio, well, guess what? In this particular situation, they've been building it since day 1 of nursing school. And they now have that portfolio, that artifact, that demonstration of learning. When we're faced with more and more remote clinical, I don't think this is going away anytime soon. This remote clinical issue that we're dealing with, many programs are going to have to struggle with it. Many boards of nursing are going to have to understand that clinical has got to look different, because we just do not have enough clinical sites that are accessible for a number of reasons, everything from safety to patient census. This is going to be a log of how they navigated and managed clinical. The Skills Hub is also tied to a program called Buzz, and this allows you and the students to communicate inside of the SML for Skyscape. And so Skills Hub is its own app, but the Skyscape app, the SML app, is going to have this Buzz feature available in it, and this allows you, it's a more secure environment than like what you'd experience with a Zoom or Skype or something of that nature, but really allows you to have those good clinical conversations with your students. So for instance, the one program literally could have 160 students out there in clinicals, and the clinical instructor lives 3 hours away. And they're doing preceptorships, for instance, as a perfect example. We're right here in the middle of the Skyscape app. They can turn on this video, this audio conferencing that is secure. You can have secure conversations and don't have to worry about getting, I think the word for it now is Zoom bombed. If you've been Zoom bombed, you know how tragic it can be. And so this allows for that secure experience. All right, so I'm going to change gears here a little bit, move towards care planning and note taking. You know, I kind of think of Reese's peanut butter cup, 2 great tastes that go great together. Many times we don't think of these 2 areas together, do we? Here's our care plan form, all 7 pages of it. Note taking, I don't have a clue if they take notes. And when they do, it's usually a random hot mess, if you will. No rhyme or reason to it. in this day and age of things moving so quickly, of students being in so many different directions, of you having to navigate so many different student needs, I'm going to propose that to build clinical judgment skills, we start to put these two together, not letting them live apart. Note-taking in a care planning format, so that even if the student is sitting at home by themselves watching a video, sitting at home by themselves reading their fundamentals textbook or their mental health textbook, they're care planning by note-taking. And now when they go to lab, they're using the same format. And when they go to clinical, they're using the same format. And this is where the NurseThink Notebook app comes into play. This is a super powerful tool that no matter where the student is in the curriculum, they're going to have locations in the app to start documenting information, tracking their learning across the curriculum, no matter what they're studying. And if there's something that pops up like, oh, I don't know, coronavirus, COVID-19, there's going to be blanks in here that they can use as well. But you're going to notice when you trial this app, you're going to notice how comprehensive that list is. And the format, the layout of the app allows the students, no matter what they're doing, to start taking notes at a higher level, okay? So instead of listing, and if you watch students take notes, there's a lot of listing. There's a lot of just random sentences and just information. Well, we train students when they're note-taking here to note-take in a care planning format. So what's related to this? What other diseases are like this? And so, for instance, we're talking about oxygenation needs, or you may be in restless leg syndrome, or you may be in one of the national patient safety goals, like central line dressing change. What's related to that? What other concepts are related to it? What other diseases are related to it? When students start training their brain to approach information this way, that's how they start approaching everything. And this helps them save time studying by making associations, doing compare and contrast. How are things similar? How are things different? And this really becomes a powerful way to learn. When they go into their reading, when they go to class, we're always challenging them, look for clinical. Look for clinical. When you're reading, you don't just read with your fingers crossed because you have an exam in 2 days. You read looking for clinical. When you're listening to that classroom lecture, when you're doing a live Zoom with your faculty, your instructor, you're always looking for clinical. That's where that clinical judgment piece becomes so important. When you're taking care of a patient, what are the key clinical judgment components, right? You'll see students when they're collecting information in clinical, they're collecting as much as possible. 5 pages of labs, I'm going to write down all 400 lab numbers. I'm exaggerating, but you know where I'm going with this. Here, we're constantly keeping them focused. What is most essential? What is it that you have to focus on? Okay, so I've taught health assessment for many years, okay? And we would always say in clinical, what do we say in clinical? Hey, students, go do your head to toe. Have you done your head to toe? Well, you know what that set us up for? Thinking literally about a head to toe, as in, here are the 7 systems, and you must perform all these skills inside, these assessment skills inside of each system. And until you've done that, right? You haven't completed your assessment. Well, guess what? That doesn't work in practice. It doesn't. The students have got to go through our entire program learning about this really interesting concept used on NCLEX, especially in the next generation of NCLEX, and that concept is focused assessment. Most nurses walk through a patient's door. You get 5 minutes to do priority focused assessment and start developing a plan of care. You get about 5 minutes. And talk to any nurse in practice. My son's a nurse here in Minneapolis. He working on an observation unit, gets to work one night. There's 17 out of 18 of the observation beds full. By the time he left, 8 hours later, at 11 o'clock, did the 3 to 11. By the time he left, well, he didn't leave at 11. There's no way. he had 13 admissions. Now do that clinical math, right? Do that clinical math. You have 17 out of 18 beds full, and you have 13 admissions, right? When we're talking about clinical judgment, we're talking about students learning and thinking clinically. What's going to happen in clinical? The notebook app, the care planning format that's here really starts to push them in that direction. They're going to take notes clinically. They're going to document clinical judgment findings from class and lab, not all findings, right? Not all findings. You don't have time to wade through the pages and pages of findings that are normal. You just don't have time. You've got to do focused assessment. You've got to do priority assessment. Notice we give them 1, 2, 3 here. We do that for a reason. That 1, 2, 3 is super important when it comes to assessments, or if you're into the next generation of NCLEX, we've added cues. Cues. What's going on in the environment? What's going on for the nurse? What's going on for the patient? Really force their hand to constantly be in that prioritization mode, whether they're reading their textbook, like I said, by themselves in the middle of a park, whether they're doing their virtual clinicals, or whether they're actually in a clinical setting, if they're fortunate enough right now, actually in a clinical setting. Maybe they're doing health assessments today. They're all in the health assessment lab. Have them come to a page, have them come to a part of the app that associates with that lab, okay? And so it's not just today we're learning lung assessment. No, the patient you're doing a lung assessment on actually has asthma, and you set that stage. You set that stage for them, and you go, okay, guys, go to asthma in your NurseTim notebook app. Go to asthma and start building your priority assessments, you priority labs, and talk about that. Or we might skip it because it's semester 1, or we might focus on it in semester 1. They go through the priority interventions. They go through all the different parts and pieces, and then they keep going, and we give them some creative space. We give them some creative space. And when we talk about NurseTim Quick, we show them how to manage information in creative ways. What other parts and pieces would you like to add to this? What other areas would you like to contribute, you put in your notes here, that may not have fit under a priority of care? And then we point them towards professional competencies, okay? And so CUSIN, I'm just a huge CUSIN fan. CUSIN ended up in the app here. Both Karen and I use it. Karen's my co-author here. And we tell students to just keep addressing these areas. Did you know CUSIN was born? CUSIN literally was born because in the 90s, 100,000 people were dying every year in the healthcare system because of medical errors. That's why CUSIN was born. And so in my humble opinion, whether a student is reading their book or whether they're in clinical with a patient, they need to be addressing CUSIN. They need to always be thinking through CUSIN. And you'll see here that we aren't having them write out a paragraph. This isn't about, can you write a long drawn out paragraph or page or a couple of pages? This is about, can you think clinically? Can you use clinical judgment? Just get a few bullets in here. Where do you see CUSIN popping up? We also do the NCLEX client needs. You'll see that that's in there as well. We encourage students to partner with other students throughout the notebook. And now one thing that I want to say too here, now if you decide to use this for care planning, they're going to very easily be able to export a PDF. But don't make them export a PDF like, let's say, asthma, for instance. Don't make them export their notebook app on asthma. Actually have them create one of the blanks into the care plan form, if you will. You know, you got to do a care plan on a patient with asthma and turn it in. Have them do one of the blanks in the back, because the notes that they're building here across the curriculum, the notes that they're building here are very important for them to keep. And they may not make a lot of sense to you, but over time, as they're taking notes in the same place in fundamentals, in the same place in lab, in the same place, they want to keep that. So don't make them pretty that up to turn into you. Have them turn in one of the blanks at the back and keep adjusting those. Or maybe you're using this as clinical paperwork now. Now think of how powerful that is. This is actually the format that they have to turn in as clinical paperwork. And oh yeah, by the way, this is the format that they use to take notes in every lecture. Talk about forming habits that are clinical judgment based. Taking notes clinically in lecture in the same way in which you will document and take notes and do clinical homework. Very powerful. In lab, very powerful. So I want to point out too, because these cover all these different areas, you want these to keep showing up. So let's say, for instance, oxygenation gas exchange. Okay, oxygenation gas exchange, this part of the app, this page in the app might show up when they're learning about patient education and how do you educate patients when they have oxygenation needs. And then they're in lecture and they're learning about oxygenation. They're of course going to have this open on their phone, on their laptop. And then they're in lab. And in lab today, they're going to learn to teach a patient about incentive spirometry. They're going to learn to teach a patient, they're going to learn to apply oxygen. And maybe that patient with oxygen, that needs oxygen has COPD. So they'd literally go in here to COPD, or they can go back to gas exchange, whatever you want them to do. Now they go to their very first clinical and they have a patient dying of lung cancer and needs oxygen support. They go back to this page, or they go to the cancer page, or both, and document a few bullets. Now they go to med surge. And again, oxygenation needs come up. They come back to this page, or they go back to lung cancer page when the cancer page when they're studying lung cancer in med surge. And then they go into peds and they have a child that has oxygenation needs. And then they go into you fill in the blank. Every time this concept comes up, they come back to the same page, whether they're in lecture, whether they're in lab, whether they're in clinical, doesn't matter. They keep coming back to the same page across the curriculum. They keep adding to these notes and adjusting these notes. That's why I didn't want you to actually have them generate a PDF off of the location where they're taking their actual notes, okay? Now, again, this is not meant to be graded unless you're using it for care planning. Have them turn in the blanks. But what can happen for instance, they all get to class, they all get to lecture. The first thing you do in lecture is go, okay, students, I want everybody to open up to schizophrenia. Today we're covering schizophrenia and mental health. You were supposed to have completed at least 2 areas, 2 notes in the notebook app, and schizophrenia was one of them. So get with someone you haven't yet talked to today. Both of you open up on your devices, laptop, phone, whatever, schizophrenia, and compare and contrast. What did you have for your priority assessments or cues, your priority nursing interventions, your priority collaborations? There's many different areas here. You could really focus in. So they do compare and contrast, right? Then they're in clinical and they have the notebook on their phone. And after they get report, they step into the nurse's break room because you can't have your phone out on the unit. They step into the nurse's break room and you say, okay, guys, I'm going to give you 5 minutes. You need to open up your notebook app and show me 1 or 2 pages in your notebook app where what relates to what you just got report on. Have them just continuously revisiting it, and that becomes a part of their DNA. Clinical judgment becomes a part of their DNA. They're going to be able to very quickly and easily check their histories in the app, their bookmarks in this app when it comes to using getting back and forth between these pages. It's just a very powerful way to learn. The other beauty of the notebook app especially is the smart linking. And so, for instance, you have them, purchase their Davis's Drug Guide, their Mosby's Lab Book, their Tabor Dictionary. All of that is in the Skyscape app. Their notebook's going to be there too, and they're going to very quickly. This little caret down here at the bottom, they're going to be able to very quickly move between their notebook and those tools. And go, okay, hey, what's the evidence base here? Okay, what's the latest on this drug? Okay, what assessments should I be focusing on? And they're going to be able to very easily move between all the Skyscape tools and back into the notebook app. Very efficient, very clinical based, because remember, they're not just using this in clinical. And we know that with the next generation of NCLEX, and the reason for all of the medical errors, the reason half of our graduates are committing medical errors, they've got to be able to get to that evidence base just in time, very quickly, in a very organized fashion. When your students do NurseThink this way, when they do NurseThink in this app, they're going to actually walk away from your program with clinical judgment just being a part of their DNA. And from every drop of research that we have on practice right now, that is no longer optional. It's actually about saving lives. Well, thank you for taking a look at this. How are we doing on questions? Do we have any ideas? Maybe someone has some other ideas here.
Yeah, so we have quite a few questions. I've been typing
Hey,
madly here. Um, so Vicky asked if you have any suggestions for students to be checked off on skills remotely. I think you touched on that maybe a little bit in the presentation, but maybe just.
So Vicky, with the Skills Hub, super powerful. You give them the assignments, they go into the Skills Hub, they go through the whole learn area, they learn about the skill, they do their video, upload it into Skills Hub. You're able to not only track it in the faculty dashboard and watch their progress, but if you already have a certain grading tool that you normally use for skills, keep using it. Use that grading tool, watching all the information coming to you through the Skills Hub. And so even if they're closed in their apartment in Queens, New York, and just can't get out for whatever reason, they're still gonna be able to practice their skill, record it, log it, document it, or if they're doing a virtual clinical, the same thing in the clinical log, and go ahead and grade it the way you normally would. Now, sometimes we have to embellish a little bit as if we were in lab with them. You know, I tell my students, you know, sometimes you have to do a health assessment on a pillow, right? If you're not fortunate enough to have others around that you can do it on, or a teddy bear or something of that nature, you might have to embellish, but go ahead and grade them. Now, we have to give them a little bit of leeway, right? A little bit of flexibility there. So good question. Thank you, Vicki.
Kathy asks, how there's certain skills she's having a hard time imagining how you could do the checkoff from home, like maybe a Foley insertion, or how would, I mean, we're in unprecedented times, obviously, but do you have any suggestions?
So I'm sorry, what's the name? Kristen? Kathy, great question. So yes, you're absolutely right. I am talking to a lot of schools right now that are actually mailing out skills kits to their students because they know that in their environment, they're not going to be able to get 20 students into a lab again, or even get schools back into the school building again. So they're actually mailing out skills kits. And so, for instance, that Foley catheter actually becomes a pop bottle lodged between two pillows. Now, make sure that you cover your pillows well so you don't get betadine all over them, and or you tell the students to simulate. You tell the students to simulate. If they don't have their skills supplies, you teach the students to improvise. So, for instance, a hollowed out noodle pushed through or straw. You could do a straw. I prefer the bigger, I think it's rigatoni noodles or something like that. Push through a piece of cardboard, that dry noodle through cardboard, and the students have to get together the supplies and just explain on the video, okay, the green highlighter is my clean swabs, and here's my trach tie, and they're doing trach care with all these improvised supplies, okay? And it actually gets pretty funny sometimes, but they're still performing the skill. Now, we're going to eventually get back together, as in get back into the school environment. And I'm coaching most programs to just say to your students, you know, do the best you can on video. I want to see you at least giving it a good try. I'm going to be very liberal with my evaluation for right now, because I know that I'm going to see you in the fall. And I'm coaching schools to plan that first week of the fall semester is an entire week of skills fairs. An entire week of skills fairs. And my senior nursing students are going to be setting up the skills fair for the new incoming nursing students or the junior nursing students. And we're still we just know that we're going to have to repeat all these skills in the fall when we get back together. That's just a part of it, but still have them doing some kind of simulated trial practice, if you will. Get video of it, put it in their skills hub, and keep them moving forward. So yes, it is tricky, but we've got to use our imagination right now, and it's very doable. Good questions.
Okay, someone actually, let's see, where is it? I'm trying to find it here. Someone said Rhoda said they did a CVL using improvised home supplies, 3 straws as a triple lumen. You probably know what
Oh my
that means more
goodness.
than I do.
Continuous bladder irrigation with 3 straws. That is, hey, you get a high five from me. You can't see me, but I'm giving you a high five. I love it. 3 straws is your triple lumen catheter, and they're running continuous bladder irrigation. Have plenty of towels around. It sounds messy.
Let's see. The format of the videos are, I believe they're MP4s. Whatever your phone records, that's the format of the video, someone had asked.
Pretty much all before, right? Yeah.
Yeah, I'm pretty sure. Let's see. How important do you find using care plans in a nursing program? My program, this is from Patricia, my program used to incorporate care plans but moved away to a different product type of learning. As a new instructor, I am seeing the gap in learning.
So, okay, so going back a century, care plans. This allows the student and the nurse to see a logical flow of the nursing care needed by a patient, okay? And it allows the student to start to describe and explore that flow, and it allows the nurse to make sure that things are happening in a logical manner. Now, the problem we've run into is that nursing, the kind of the academic mindset especially, has become very linear because of that flow. And so this is why when you look at the notebook app and the way that we do our NurseThink notebook flow, it's all clinical judgment. So it's not necessarily linear as much as you're in a constant mindset of what's absolutely essential right now at this point in time for this patient. So it's a clinical judgment approach, and this clinical judgment model that I'm talking about, if you're not familiar, you go to National Council State Boards of Nursing. It's the model that they're using to build the new NCLEX. So what we wanted to do is have students start creating habits that will help them in practice. And that clinical judgment model is the single most researched model of nursing practice that we have access to right now. It's very current. It's just happened and is happening and continues to happen. So when you say, is care planning outdated? Is care planning still relevant? What we need to do is create a habit of managing information that allows the student, soon to be nurse, to address those patients' needs in a very efficient and effective, highly effective manner. And that's why we set up the notebook the way we did. So yeah, I understand what you're saying about care planning. It does allow the students to start to put pieces together, but most importantly, we want that putting pieces together to be a habit. And that's what we're trying to do with the notebook. Great question, thank you.
I'm trying to find look at the questions here. I like that there are different HCPs demonstrating the skills, example RN and stuff like NP, etc. So that's one point. The NurseThink app will wrap up and give you information on how to find more information about what's going on, or where to find these tools. Daffodilus said, my students did an improvised trach checkoff by using different supplies to make inner and outer cannula, e.g. toilet paper as the outer cannula and a pill bottle as the inner.
Oh, nice. Isn't it amazing how creative we get? Although simulation instructors they always take the cake with creativity. I love working with sim instructors.
Okay. One more question. How do these tools work if a student is ESL?
So that's a great question. These tools, what they do is they really, when we're face-to-face with ESL students, we have to be very careful that we're communicating clearly and that we're reading their communication well. Whereas in these environments, you know, when it comes to more text-based, when it comes to watching a video that they've created and being able to rewatch it, when it comes to them tracking their activities, the student has to communicate clearly and has to practice that clear communication. The student also in these tools gets access to a lot of what I call clinical speak, and they can't avoid it. I know that, for instance, I work in Haiti a lot, and I know just enough Creole to be dangerous, but I don't want to always tell the person I'm communicating with that I don't understand them. So what do? I nod and smile a lot. So when we're in person, students who are ESL might be tempted, I mean, because they've got a lot going on that they have to deal with, they might tend to nod and smile a little bit more, whereas in these environments, they have to really kind of slow down and process and focus. And so these environments are going to take that ESL student to a deeper level, and it's going to help them, it's going to give them the time to do that, the time to process. When your ESL student is standing there with you, white coat, PhD professor, MSM professor, doesn't matter, there is a level of power that they feel that could be intimidating to them. Whereas here, they're going to have a bit more time to process, a bit more time to dig, a bit more time to kind of go deeper, rewatch that skills video a couple of times that they created, that someone else created, that's on YouTube. Take another look at that evidence base. Take another look at their notes and how they described something. So this is really going to be, it's going to be powerful for them. And it gives you more information too. When you're looking at that notebook app and seeing how they laid out their priorities, that gives you the ability, when they turn in that care plan or they turn in that clinical paperwork through the notebook app, that gives you the ability to truly analyze, did they understand? And so you get a lot of good opportunities here for your ESL student and helping them develop at an even higher level. Great questions.
Let's see if anything else has popped up. Give me 1 second. Kathy's asked, are these two different apps, Skills Hub and NurseTim Notebook? Yes, they are two different apps.
Yep.
So is this app usage appropriate for fundamentals?
Oh, yes, please. And so if you think back to my comments on medical errors, okay, when we look at medical errors, especially by new nurses, a majority of them somehow link back to what they learned in fundamentals. Take-home message. And we've seen this research consistent over the past 20 years coming out of National Council. They do research on new nurses. The most important class in your program is fundamentals. These apps that I showed you, Skills Hub, the clinical log, the notebook app, are meant to be used in every class, every lab, every clinical across the curriculum. And one of the big reasons, there's two big reasons. One of them is obviously clinical judgment. The second one, we need to make sure that fundamental principles, concepts, learning gets pulled across the curriculum for each individual student. That is so important in today's age. And it's important for clinical practice, but it's also going to be, it's more and more important for NCLEX as well. So please do start in fundamentals and use these across the curriculum. Great questions.
Let's see. Any more questions? We're about to wrap up. So if anyone has any final questions, go ahead and post them now. One question, do I need to change my lesson plan to use these tools?
Not at all. Not at all. And as a matter of fact, we would encourage you and or help you to use these tools with your current lesson plans first, kind of get a feel for where they are. But these fit with any textbook, these fit with any curriculum type, any lab structure, any clinical structure. No matter how you lecture, these tools are very useful.
Okay. All right, I think that just about does it for questions. One more thing. That's it.
All
No further
right.
questions at this time. I want to thank everyone for attending. Why don't we flip to the last slide? So if you are interested in any of the solutions discussed today, please contact sales@skyscape.com. The Skills app can be found on the App and Play Store. You can download the Skills app, and there are 20 free skills, so you can view it and see what it looks like. The cost for that is $29.95. The dashboard is available for faculty if it is adopted by your program for free. For more tips on how to use the NurseThink notebook, go to nursethink.com, and to find out how to access any of these resources, you can go to education.skyscape.com and then click on Nursing Education, and you'll have all the information about Skills Hub and the NurseThink notebook and the Skyscape Medical Library and all the Skyscape solutions there. This webinar is being recorded. It will be available on demand later this week, and you will be notified via email when it is available, so you can share with any of your peers and colleagues that may not have been able to attend. If you do find you have additional questions, please feel free to reach out to us at webinar@skyscape.com. Thank you, and have a great day.